Okay, we've finished with talking about IVs. Let's talk about medications. Medications is an area that's often very overwhelming to students. I mean, there are thousands of medications, and how am I going to remember all the names and all the, the rates and the dosages and side effects and teaching? Well, the best way to learn medications is to learn them by category. Because if you learn them by category and you know what the category does and you know this is part of that category, then you know what it does. Also, if you know how a medication works, for example, it affects the, stimulates the sympathetic nervous system, and of course you know what the sympathetic nervous system does, then you can again figure out what the drug does and what the patient would expect, how it would be used and that type of thing. Again, one of the things to remember is when you're dealing with side effects, many times side effects are too much action. So if you know what the drug does and the patient is experiencing a side effect, sometimes that side effect is just the drug is functioning way too well and you're getting some other things going on. Now, the frequently tested medication, or the question that many times is asked on the NCLEX is your patient is getting a particular drug. How would you know it is effective? So again, make sure you know if a patient, for example, is getting a medication as an anticonvulsant, how would you know it was effective? Well, the patient would not be experiencing seizures. So again, make sure you know about effectiveness of medication, because many times that's what they ask. The other frequent question asked on the NCLEX with regard to medications is, what would you teach the patient? And again, the type of things you'll teach the patient is they need to be compliant with the drug regime and take it as ordered. They need to know when to contact the physician when something's going wrong. They need to know what the side effects are. They need to know whether they take it with food, without food, in the morning, at night, those type of things. So again, the teaching that goes with medications is frequently tested. Don't worry about learning both generic and trade names. The test, the NCLEX, will give you both of those medications. Don't worry about learning dosages. Again, with probably just a couple of exceptions, and one of those exceptions is digoxin. Make sure you know both digitalizing and maintenance doses for dig. But most medications, the nurse does not decide how much the patient gets, the physician should. And while it is a nursing responsibility not to give medications outside of the normal dosage range, that isn't something that's frequently tested on the NCLEX. And one of the other things to remember is, back when you're in anatomy and physiology, you remembered that the liver detoxifies or metabolizes most medications, and then most are excreted by the kidneys. So again, knowing what the liver and kidneys have to do with medications, you can figure out some of the side effects that the patient may experience. Okay, so we are all set up. Let's talk about medications. The first ones we're going to talk about are the adrenergic. Now, let's talk first about how they work. This category of medications stimulate the sympathetic nervous system. So what you will see is an increase in peripheral resistance. You will see an increase in blood flow to the heart. You will see bronchodilation. You will see an increase in blood flow to the skeletal muscles. And you will see an increase in relaxation of the uterus. So those are the type of things that this category of medication does. Okay, knowing that, some of the examples of medications that are adrenergics are Levophed, dopamine, adrenaline, and Dobutrex. Okay, the action of these medications, again, they are sympathetic nervous system stimulants. They stimulate the beta-2 receptors in the lungs. It's one of the things they do. They are used for cardiac arrest and COPD. Let's talk about the side effects you will see with the adrenergics. What they can cause is dysrhythmias, they can cause tremors, and they have anticholinergic effects. And remember, the anticholinergic effects are the dry mouth, the urinary retention, those type of things. So nursing considerations for patients that are getting adrenergic is you want to monitor the blood pressure. You want to monitor peripheral pulses, and you want to check output, again, because there may be urinary retention. When you're giving these type of medications, again, the patient may become a little sleepy or drowsy, so you want to make sure that they're not doing anything such as driving a car if they're experiencing some of the sedation that may happen with this. Another category of medications are your anti-anxiety agents, and some examples are Librium, Xanax, Ativan, Vistarol, and Equinil. What these medications do is they affect the neurotransmitters, and they are used for anxiety disorders, manic episodes, and panic attacks. Let's take a look at some of the side effects and nursing responsibilities. The side effects for these type of medications are sedation. Many times the patient will become quite sedated. The patient may become confused, and there may be hepatic dysfunction. What you want to do is to make sure and check the liver tests, which are your AST and ALT, to make sure the liver is doing fine, because again, this is a case where the liver detoxifies these medications. The nursing considerations or responsibilities for the anti-anxiety agents, there is a huge potential for addiction or overdosage with these medications, so they need to be monitored closely. While the patient is taking these medications, they should avoid the use of alcohol because it causes respiratory depression. And again, they need to monitor the nurse should monitor the liver function to make sure there isn't a problem. With these type of medications, you don't want to discontinue them abruptly. The patient should be weaned off them. And one of the things that's important to let your patient know is smoking and the use of caffeine decreases the effectiveness. So if the patient takes up smoking or drinks a Diet Coke, caffeinated Diet Coke every day, it will decrease the effectiveness of the anti-anxiety agents. The next category of medications we're going to talk about are the antacids. The type of antacids, some examples that you may see are Amphigel, milk of magnesia, or Maalox. What these medications do is they neutralize gastric acids. These medications do not coat the ulcer. That's a different type of medications. These medications are used for peptic ulcers. They are used to prevent or treat indigestion, and they are used for reflux esophagitis. What the side effects you will see are they can cause constipation or diarrhea because they interfere with the GI tract, and there may be an acid rebound after the medication. With these type of medications, the nursing consideration, can interfere with the absorption of antibiotics, iron preparations, INH, remember medication used for tuberculosis, or oral contraceptives. If patients are getting antacids, and again, this is a frequently tested topic, you want to give them 1 or 2 hours after other medications. Again, 1 or 2 hours after medications. When patients are taking antacids, again, you want to make sure that you are checking their fluid and electrolyte balance, because sometimes both calcium and the phosphates can get messed up because they are contained in the antacids the patient takes. When the patient takes antacids, they should be taken with 1 ounce of water. And again, we talked about taking them 1 or 2 hours after other medications. The medications, the antacids, are usually taken 1 to 3 hours PC, which means after meals, and HS. Usually you don't take the antacid with meals because it then would cause a delay in gastric emptying, which would result in more indigestion and more problems. So again, key thing with antacids, 1 to 2 hours after other medications. They are usually taken 1 to 3 hours after meals and at HS. Let's talk about the antiarrhythmic medications. These medications decrease myocardial irritability. And some of the good examples you'll see with antiarrhythmics are atropine sulfate, lidocaine, pronestil, quinidine, and isoprel. What these medications do is they interfere with the electrical excitability of the heart, and they're used for atrial fibrillation and flutter, tachycardia, and PVCs. Side effects you will see with this type of medication is the patient may become lightheaded, the patient may experience hypotension, a decrease in blood pressure, and they may have urinary retention. One of the key things with the antiarrhythmic medications, and probably most important, is you need to monitor vital signs very, very frequently to find out what's going on, and also monitor cardiac rhythm. Okay, let's now talk about antibiotics. And before we talk about antibiotics, there's a couple things that I think need to be said. Antibiotics, again, we're going to talk about the different families of antibiotics. And again, this is an excellent way if you know that, for example, an antibiotic is an aminoglycoside, then you'll know how it works and what it does, what some of the side effects are. But some of the general side effects for all antibiotics, the first problem that we see quite often is allergy or hypersensitivity. This can range anywhere from a mild rash or hives, and this would be treated with antihistamines, to a severe allergy or hypersensitivity, and this is anaphylactic shock. And again, shortness of breath usually is your first symptom you will see with a severe allergy. And it usually will occur within 20 minutes of taking the medication. And the treatment for the severe allergy is epinephrine and bronchodilators. Again, remember, we talked about this, or we'll talk about it again later, is this is a medical emergency and the patient needs to have an airway and, go from there. The second type of general problem that happens as a side effect of antibiotics is a superinfection. Now remember, there's normal flora in your body that does good things. It keeps your GI tract running as it should. It keeps your mouth the way it should be. But antibiotics are not always selective. They don't always just kill bad bacteria. In some cases, they destroy normal flora. And if the normal flora is destroyed, an example of good is the mouth, the GI tract, the respiratory tract, the GU tract. Again, that can cause problems. So that's, again, one of the side effects is the superinfections that can happen because normal flora has been destroyed. And the third very common complication with all antibiotics, regardless of the family, is organ toxicity. And again, I think you know what organs I'm going to talk about. Remember, most medications are detoxified or metabolized by the liver and excreted by the kidneys. And the organs most often involved with problems with antibiotics are the liver and the kidneys. Okay, let's talk about a particular antibiotic family, and this first one is the aminoglycosides. Some of the examples you'll see for this are gentamicin, neomycin, streptomycin, and tobramycin. Again, the different families act different ways. The aminoglycosides inhibit protein synthesis in gram-negative bacteria, and they are used for Pseudomonas and E. coli. So that's kind of what they do and why they're used. Let's talk about some of the side effects you'll see. They can cause ototoxicity. Remember, ototoxicity is problems with hearing, and it's because it interferes with the cranial nerve. It can also cause nephrotoxicity. Again, remember, many of the medications are excreted by the kidneys, so we want to make sure and check renal function. Usually this type of medication, let's go back. Some other side effects. We talked about the ototoxicity. Some of the other side effects you will see are anorexia, nausea, and vomiting. And again, the aminoglycosides may cause diarrhea because they kill off the normal flora in the GI tract. Okay, nursing considerations. Again, we talked about the ototoxicity as a complication, so we need to check the 8th cranial nerve, or the one involved with hearing, to make sure the patient's hearing is not being destroyed. You'll also want to check renal function to make sure that the urine output is okay. You'll check the BUN. And again, urinary output should be a minimum of 600 cc's a day, probably more like 1,200 cc's per day. These type of medications usually are taken for 7 to 10 days. And one of the problems you experience is patients take it until they feel better, which isn't always 7 to 10 days later. Many times it's earlier. So they're non-compliant and don't complete the course of antibiotics. And that is a problem. Again, with these medications, because they can affect renal function, is you want to encourage fluids. Normal intake is 1,500 to 2,000 cc's a day. So if you're encouraging fluids, you would encourage them to 3,000 cc's a day. Now, one of the things I want to talk about also, and it's used with antibiotics, such as the aminoglycosides, is many times the physician will order therapeutic drug monitoring. And what that means is they will check both the high level and the low level of the medication in the system. It's called the peak and the trough level, because they want to make sure that, again, for these medications that have what they call a narrow therapeutic index, meaning this much is good, this much is too much, you'll have problems, and this much is not enough and you won't get the good effects of it. So again, a narrow therapeutic index, many times they will use what they call therapeutic drug monitoring. They will monitor both the peaks and the troughs of the medication. So what you want to do for the peak level is you draw it 45 to 60 minutes after the drug is administered, because this is its highest level, the peak. Again, we want to make sure if it goes too high, we're going to go from good effects into toxicity, and we don't want that to happen. Now, with the trough level, what you will do is you will obtain a blood sample just before you give it again. Because again, this is the lowest level, and you want to make sure the lowest level is not too low, because if it drops down so that it's supposed to be here and it's way down here, then that medication has been ineffective for a period of time, and they're not getting enough to kill the microorganisms that they should be. So again, remember, peaks are done about 45 to 60 minutes after the drug is administered. The trough is done just before the medication is administered again. And each individual medications have specific peaks and troughs that tell you that they are within their therapeutic index.